Hello again, it's me, Myra. Time for another anatomy lesson. This week we're going to be talking about the lymphatic system. Your lymphatic system is a group of organs, vessels, and tissues that protect you from infection and keep a healthy balance of fluids throughout your body. Lymphatic system organs include your bone marrow, thymus, and lymph nodes. Swollen lymph nodes are a sign of common infections like strep throat, but also can be more serious like cancer. What is the lymphatic system? The lymphatic system is a network of organs, vessels, and tissues that work together to move a colorless, watery fluid, lymph, back into your bloodstream. As a vital part of your immune system, your lymphatic system protects you from infection and destroys old or abnormal cells your body doesn't need. Lymphatic system functions also include maintaining normal fluid levels in your body and absorbing fats and fat-soluble vitamins so that they can make their way into your bloodstream. I'm going to turn you around and we're going to look at a diagram. Here is a diagram of some of your lymph nodes. You have cervical, lymphatics of the mammary gland, cisternocele, lumbar lymph nodes, pelvic lymph nodes, lymphatics of the lower limb, as you can see right there, thoracic duct, thymus, axillary lymph nodes there in your armpits. Here's your spleen, lymphatics of the upper limb, inguinal lymph nodes there. I'm going to carry on. So what does it do? It collects excess fluid from your body's tissues, returning it to your bloodstream. This supports, once again, healthy fluid levels in your body. Your lymphatic system also filters out waste products and abnormal cells from the fluid. It helps your body absorb fat. Most nutrients can travel through tiny openings called pores in the walls of your capillaries, your small vessels, right? And your body can then absorb and use them. But certain fats and other molecules are too large to travel in this way. So your lymphatic system collects fluid from your intestines that contains these molecules and transports them back into your bloodstream. It also protects your body from invaders. Your lymphatic system is part of your immune system. It produces and releases lymphocytes, a type of white blood cell, and other immune cells. These cells look for and destroy invaders such as bacteria, viruses, parasites, and fungi that may enter your body. So how does it work? Each day, about 20 liters of plasma, that's the liquid part of your blood, flow out of tiny pores into thin walls of your capillaries. Imagine water seeping out of a sponge. Where does the liquid go? It delivers oxygen and nutrients to the surrounding tissues of each capillary. The tissues hungrily soak up all the nutrients while leaving behind waste, kind of like a kid who finishes their food but leaves a dirty napkin behind. The plasma doesn't mind cleaning up the mess. It picks up the waste and returns to your bloodstream the same way it came, by flowing back through the pores into the capillary walls. Each day, about 17 liters of plasma return to your bloodstream in this way. Since 20 liters initially flowed out of your capillary walls, that means 3 liters are still roaming around in your body's tissues. That's where your lymphatic system steps in. Tiny lymphatic capillaries. They pick it up and then send it back. These vessels keep the lymph moving until it ultimately reaches one of two major ducts in your upper chest. These are called your right lymphatic duct and thoracic duct. And they're a little bit like highway on-ramps. They merge into large veins called your subclavian veins and empty the lymph into them. From there, your lymph re-enters your bloodstream and can flow through your body again. So what are the lymphatic system organs? Bone marrow. This is the soft, spongy tissue in the center of certain bones like your hip bone, backbone, breastbone. Your bone marrow has the vital job of making white blood cells, red blood cells, and platelets. Thymus. This organ is located in your upper chest beneath your breastbone. It's most active before puberty. It's where the T cells, they're a type of white blood cell, fully mature. T cells help your body fight off invaders. Lymph nodes are bean-shaped glands that monitor and cleanse lymph as it filters through them. They clear out damaged cells or cancer cells. Your lymph nodes also store lymphocytes and other immune system cells that attack and destroy harmful substances like bacteria. You have about 600 lymph nodes scattered throughout your body. Some are closely connected in groups called chains. You may be able to feel some lymph nodes in your neck, groin, armpits. Others are deeper into your body. The spleen, the spleen, it's the largest lymphatic organ located on the left side under your ribs and above your stomach. The spleen filters your blood and removes cells that are old or not working properly. It also keeps red blood cells and platelets available just in case your body might need them. There's also a mucosal, it's called MALT, mucosal associated lymph node tissue. It's a mucous membrane throughout your body, has many things it does. It lines your tonsils, airways, small intestines, appendix. MALT looks for and destroys germs that could harm you. So what are the other parts of the lymphatic system? Your lymphatic system is like a big team. Other key players include your lymph. Lymph is also called lymphatic fluid, collection of extra fluid that drains from cells and tissues in your body, and it isn't absorbed through your capillaries. Lymph contains many different substances, including proteins, minerals, fats, damaged cells, cancer cells, and germs. Lymph also transports infection-fighting white blood cells, known as lymphocytes. Lymphatic vessels are tubes that form a complex network throughout your body. The smallest are a capillary, and they connect to smaller and larger tubes. We talked about the two main ones, the thoracic, and then the one in your chest, right? Already. What it does is it's close to vessels that pulsate. So when they pulse, and there's muscles there, it keeps it going in one direction because the muscle squeezes and it keeps the flow going in the right direction. Collecting ducts. Once again, the two main ducts, the thoracic and the right lymphatic. So you have two main ducts in your upper chest. They empty the lymph into your subclavian veins. These are your right lymphatic duct and your thoracic duct. These ducts are like highway on-ramps again. Points the lymph in the direction that it goes. It can go backwards, okay? So once that pulsatile muscle squeezes, keeps the lymph going in the right direction. You also have tonsils and adenoids. These structures trap pathogens from the food you eat and the air you take in. They're part of your body's first line of defense against invaders. Your tonsils are in the back of your throat. Your adenoids are just behind your nasal cavity, but are only active during childhood. What are some conditions that affect lymphatic system? Let's go over those. So many conditions can affect the various parts of your lymphatic system. Some happen during development before birth or during childhood. Others develop as a result of disease or injury. Some common diseases and disorders of the lymphatic system includes lymphadenopathy, that means swollen lymph nodes. Infection, inflammation, and cancer can cause swollen or enlarged lymph nodes. Common infections that can cause enlarged lymph nodes include strep throat, mononucleosis, HIV, and infected skin wounds. Lymphadenitis refers to lymphadenopathy that's caused by an infection or inflammatory condition. Lymphedema. Lymphedema is swelling or accumulation of fluid. A blockage in your lymphatic system can cause lymphedema. It can also happen when your lymph nodes have been removed to treat a condition like cancer. We see that a lot in breast cancer. They have to remove the lymph nodes in the armpit. And so that can cause the arm, whichever has the mastectomy side, that arm can become swollen or have lymphedema, okay? So with lymphedema, fluid most commonly builds up in your arms or legs. It can be very mild or quite painful and disabling. People with lymphedema are at a risk for serious or potentially life-threatening deep skin infections. Once again, cancers of the lymphatic system. Lymphoma is a cancer of the lymph nodes that occur when lymphocytes grow and multiply uncontrollably. There are several different types of lymphoma, including Hodgkin's lymphoma or non-Hodgkin's lymphoma. Cancerous tissues can also include others. Also, lymphangitis, inflammation of the lymph nodes. Lymphangioma, this is a condition that when you're born with, it involves the presence of non-cancerous fluid-like bumps or cysts under your skin due to overgrown lymph vessels. Lymphocytosis, with this condition, there's a higher than normal amount of lymphocytes in your body. Lymphatic filariasis is a parasite infection that causes the lymphatic system to malfunction. Cattleman's disease, as it's known, involves an overgrowth of cells. Autoimmune syndrome is a rare genetic disorder in which there's a high number of lymphocytes in your lymph nodes, your liver, and your spleen. Mesenteric lymphadenitis, inflammation of the lymph nodes in your abdomen. What are tests that can be done? What modalities? So we talk a lot about X-ray, CT, MRI, blood work. So what are the tests that we use today to check out our health of our lymphatic system? Well, You want to do, there's imaging tests like CT, computerized tomography, magnetic resonance imaging, MRI. And of course, your provider will determine what is best for what they're looking for and which test will be better for whatever they need to see. Lastly, before we go, I'm going to show you two more pictures so kind of you can get a better understanding. We talked about the adenoids, the intestines, the bone marrow. I just want to show you a picture of it. Let me get my pointer. So here's the adenoids. So we said the tonsils are there. Your adenoids is right behind your nasal cavity. There. There's your thymus again. We talked about the thymus earlier. Of course, there is your spleen on the left side of your body. Here's the bone marrow. That's what the bone marrow looks like. This is just a magnified image of a lymph node in the leg. Vessels, they're all over your body. All of these are lymph vessels, lymphatic vessels. Your intestines again. And then lastly, I'm going to bring this one up. So once again, your adenoids are there, your tonsils are there. Here is that right lymphatic duct, very important. Here's some more lymph nodes. This is kind of what your thymus looks like. There. There's your spleen again. This is just what a lymph node looks like. There. There's your bone marrow again. All right, I hope you've enjoyed this lesson on lymphatic system. Come back next week. We're going to be going over muscular. Have a good day.